Let's go to another drug now.
Yes.
Theophylline. What is theophylline?
Theophylline, the mechanism of action.
Occurring methyl santhine group of drugs.
Yeah.
When do you commonly give this drug?
For bronchodilation, sir.
Which condition?
Bronchial asthma, sir.
And COPD also we give,
And COPD also. Yeah. Yes.
Okay. What's the mechanism of action of this drug?
I'm not sure, sir. I forgot.
It is basically a non-specific inhibitor of phosphodiesterase. Phosphodiesterase actually breaks down, metabolizes cyclic AMP. So when you block the phosphodiesterase, cyclic AMP level increases. So also inhibiting the adenosine. Okay.
Yes, sir.
It can increase cyclic AMP. So sometimes you take this drug as an overdose. So what are the manifestations? We take so many tablets for a suicidal purpose or overdose purpose. What are the side effects?
Sir, excitement, exfoliative dermatitis.
The early stages of side effects when you give the word is anorexia, nausea, vomiting.
Okay.
J side effects. But when you take large dose for purpose of overdose, you may get acidosis, basically hypokalemia.
Hypokalemia.
And can produce bad tachycardia and all types of arrhythmias and seizures.
Okay.
It's not a very simple drug. It's a difficult drug. You have to be very careful when you give this drug. What's the route of excretion of this drug?
Theophylline through liver, sir?
Kidney. So in the renal failure, of course, you have to be very careful. How do you treat the overdose?
Dialysis.
Early stages, you may try activated sarcone.
Okay, sir.
Option. And hemodialysis is a usual line of treatment.
Okay, sir.
Okay. Common side effects of this drug, as I already told you, anorexia, nausea, vomiting. And what factors are deciding the side effects? Who are likely to get side effects?
Patient is in AK or CKD, there will be the drug stays in the blood for so long.
That's true. In extremes of ages, it produces problems. Small children or elderly citizens, it can create problems.
Okay.
And people who are having liver disease, this drug is metabolized in the liver and excreted through kidneys.
Okay.
So the congestion of the liver or hepatitis or cirrhosis, drug will not metabolize and it can get into trouble.
Okay.
So toxicity is seen in liver disease, particularly heart failure.
Okay.
And one peculiarity of this drug is if you smoke, consume alcohol, decreases the level and effectiveness decreases.
Okay.
It will not be effective if you continue to smoke.
Okay.
And it is a very narrow therapeutic range. What is therapeutic range? Narrow therapeutic range means what?
So this is the range in which that the drug should stay in the blood to cause the expected outcome. If it goes beyond or goes under the range, it will have adverse side effects. The risk will outweigh the benefit.
Not really. The narrow therapeutic range means the effective dose and toxicity dose are very close.
Okay.
That gap is very narrow. So anytime it can go into toxicity, it can come to therapeutic level. So you need to be careful. What is aminophylline?
Aminophylline
is a derivative of theophylline. Theophylline, ethylene, diamine. So why do you want to give aminophylline when there's theophylline already?
Can be given IV, sir.
Why is given IV, not theophylline?
It's soluble, but theophylline is not.
It's soluble. But the problem with the aminophylline intravenous, what are the precautions you take when you give aminophylline intravenously? You have to give it very, very slowly over a period of 20 minutes.
Okay, sir.
If you push fast, it can produce hypotension.
Okay.
Arrhythmias, even seizures.
Okay, sir.
Okay. So you have to be a bit careful when you give this drug. Also, Naive patients you can give it easily, but patient is already on theophylline before coming to the hospital. It's always better to do the levels and then go ahead.
Okay, sir. Okay.
When do you commonly check the drug levels?
Uh, One thing is when the patient has an alleged history of, I mean, over toxication, sir, and we have to confirm whether it's because of this drug or any other cause to be rolled out.
In the ward, patient is on theophylline when we check the drug levels.
Uh, the expected outcome is not there, so
Okay.
we
So
have to confirm whether the drug has reached the therapeutic level.
any drug for that matter,
Okay, sir.
rule of thumb is half-life multiplied by 5 times.
Okay.
That's the rule of thumb.
Okay, sir.
So drug levels in theophylline has to be done 5 days after starting the drug.
Okay.
Or when the patient comes to hospital and you find that it's already on theophylline, you check the levels before you give the next dose.
Okay, sir. Okay. So this is chest X-ray showing um, a right-sided cavitary lesion with air shadow in the rim, circumambulating the opacity. Probably Aspergilloma, sir.
Yes. Which are the predisposing conditions for Aspergilloma?
Any cavitary lesion or any destructive lung lesion like bronchiectasis or even TB showing causing cavity or lung abscess
How do they
causing.
present?
Sorry, sir.
How do they present?
Patient will have chronic cough, shortness of breath, and mild desaturation probably.
Actually, it's a very isolated lesion.
Okay,
So
sir.
systemic symptoms may be minimal, but they come with hemoptysis.
Chronic hemoptysis.
And what's the treatment?
Sir, IV voriconazole, sir.
Treatment of choice is usually resection of that area.
Yeah, as for Aspergilloma, yes. Yes.
Unlike the invasive form of aspergillosis, aspergilloma is usually removed.
Yes.
And this is X-ray taken, and you can take the X-ray in different positions and demonstrate that it is moving inside the cavity.
Okay, sir.
But here, all the sides of this mass shows air, meaning thereby this is a separate thing, a ball inside the cavity.
Okay, sir.
Suppose it is touching any of the wall, then you have to tilt the patient to take X-ray or go for a CT to confirm it is aspergilloma.